Hey everyone, this is Reggie from Restore Plus Physical Therapy, and welcome to today's tip of the day. Have you fallen down before, or have you had an injury from a fall, or have you seen anyone fall down? The reason why I ask that is because during this time of the year, where there's snow and ice on the ground, slips and falls drastically increases. And actually, even if there's no ice on the ground, we see patients who get injured because of a slip or fall. And this is something that, especially as people get older, the balance becomes worse, right? We see that quite a bit. We have older patients who come in for a fall prevention program. And the fall prevention, this is something that actually many years ago I used to do fall prevention workshops. So I used to teach people how to fall down properly. And in this video, that is what I want to share because I have had several patients who ask me how should they be falling down, especially now that winter is here and there's snow and ice on the ground. So just pay attention to this because I'm going to show you what are some of the best and safest way to actually fall down. All right, so always remember this. An example there will be because patients tell me or people tell me, well, when you slip, it happens so fast. Slip and falls, they happen very fast. So how you won't have time to think. And if that's the case, how are you going to react, or how are you going to think about what you're going to do? The key there is practice. Okay, you have to keep practicing so that becomes a natural reaction for you. Think of this example: people who practice judo, for example, right? They get thrown on the mat all the time, and they keep practicing that because they learn how to roll, and they keep practicing it so often that it becomes second nature to them. Because in an actual match, they don't know when they're gonna get thrown, when they're gonna fall down. So the split second that they get thrown, they know how to react and they're gonna roll. Okay, same thing in a real life scenario. You have to practice it often enough that becomes second nature to you. Of course, you're not gonna practice the actual fall itself. You're going to, it's mental imagery. You're going to visualize that and practice some of the movements without actually falling down. This is especially for the older people. If the younger ones, you want to practice that on the mat, yes, you can do so. For older people, your mental imagery, you visualize it, and that can help you be able to react instantly. All right? So now, let's get to the point of what is the safest way to fall down, right? The safest way to fall down is if you're going to be falling on your butt, your buttock area. The reason why is because we have extra fat there, so we have paddings there. Some people have more than others, but in general, with the whole body, that has an added layer of protection against an impact. So we have the fat and muscles there. So you want the best. If you're going to fall on one place, you want to fall on your buttock area. Okay, so and that's how, we'll demonstrate how you do that. So, an example, because I'm gonna show you how to, like, if you're falling in different directions. So let's say you're gonna fall backwards, right? So key thing to remember is you want to bend or fold like an accordion. Okay, last thing you want is to fall down like a log, which a lot of people do. Or when they go forward, is they go on their outstretched arms. And that's why in falls, very common is the wrists get fractured because we have a reaction defense mechanism that we extend our arms and then this is gonna break. Okay, always remember, you want to fold. Okay, so you're folding either the body going down like this, right? You can practice that, or the arms folding like this. Doing some wall push-ups or incline push-ups definitely will help with this. So you're not extending and you have the strength to be able to support the body. Okay, so that's one, is you want to fold. The other one is you want to tuck the chin in. because if this is up, you're going to fall more easily. Okay, and this is something that we used to practice in martial arts. You have to tuck the chin in. When I was doing my kicks, if not, you fall flat on your back, and then you're gonna hit the back of your head. Okay, so let's now practice that. So let's say you're going to fall backwards. Falling backwards is, let's say when you slip, you don't want to have your head like this. So when you slip, you want to tuck the chin in, and you want to sit down. Imagine, think of it that you want to sit down. Okay, it doesn't matter if you have hip, knee, or any kind of arthritis or pain. It's still not as bad if you sprain that compared to if you actually break your bone. So you're looking at, you will get hurt, but you're looking at what's the less damage that you can sustain. Okay, and also falling properly may prevent you from getting an injury, maybe some bumps or bruise, okay, which will take any day over a broken bone. So if you slip this way, you want to fall, you want to tuck your chin in, and you want to sit on the floor. All right, so you want to sit down. So if you're slipping this way, you want to tuck the chin in and sit on your butt. Try to sit on your butt as much as you can, okay? And if the momentum is really a lot, you can roll. That's why the chin tucked in is important, because if your head is this way, you're gonna hit the back of your head. So if your chin is tucked in, you can roll because you're folded, okay? So when you slip, you go down, slip the butt, and then you can actually, the head is tucked in, your chin is tucked in, you can actually roll, okay? So that's if you're falling backwards. Now, what if you're falling sideways? Falling sideways, a lot of times we hit shoulder and hips, and this is when I see patients have hip fractures, shoulder fractures, humeral bone or the femoral neck here. That's when you get those injuries, okay? So this is what you want to do. Same principle. You want to fold like an accordion and tuck the chin in and also roll. So those are the three constant things. That's it. If you trip sideways, right? You're folding sideways. What you want to do is you still want to fold, okay? Tuck the chin in, and you're going to fold. You want to land on your buttocks, and that's why you're rolling. And if you do it, even if you roll this way, then it's okay. And if the force is a lot, you can continue rolling. It's still better than trying to stop your momentum immediately, okay? So if you're going to be going sideways, you're going to be going this way, tuck the chin in, you go down, and then you can roll. All right? So visualize it that way. You're going to fold, tuck your chin in, fold, and roll. Now, if you're going forward, let's say you trip on something, same principle. You're going to tuck your chin in, okay? Because you never want to have your arms outstretched like this, because then it's going to break your wrist. And you don't want your face first, because that's when I see patients with black eyes, broken nose, broken teeth, okay? You fold, tuck your chin in, and then if you can roll, you roll. If not, then this is when the elbows will be bending. And this is when I actually taught this in one workshop before. Actually, I think the same day, one of the participants went home, tripped on the steps, and actually was able to use the technique to prevent herself from getting hurt. And she actually, I think she emailed me a day or two later, thanking me for showing her that. So, and that's why I like to share this knowledge. All right, so let's demonstrate that. When you trip here, tuck the chin in. What you want to do is you want to fold, okay? And when you fold, you want to be able to still support yourself. And if the force is a lot, then you can actually still roll, okay? So if you trip, let's say you trip this way, tuck the chin in, you go down, and you can still roll. You see, you're bending the elbow. You're not keeping it straight, because you don't want to go face first this way. So when you're going down, all right, you trip, and then put the chin in, and you still want to roll, okay? So those are the three common directions where you can fall. You see the constant there? Tuck the chin in, you fold, and then you roll. Minimize the damage. Okay, disclaimer there. Yes, you can still get hurt. Yes, you can still get an injury, but it's less than, you're lessening the chance of you getting hurt. And also, if you get hurt, it's a less injury than if you break your bone, break your face or something. Okay, well, the best way still is to prevent the falls. All right, but if you do, this is what I want you to do. All right, I know this is a little bit long, but I hope you learned a few things here. And I want to thank you so much for spending the time. Thank you very much for watching this video. Let me know if you like this video. Would love to hear that in the comments. If you love this video, you find it helpful, please share this and subscribe, and share this with as many people as you can, so that way we can all work together in keeping everybody safer. All right, you have any questions, feel free to reach out. If not, then I'll see you on the next video. Bye.